To Medical Monday. Today's topic is going to be low back pain.
Low back pain.
Low
Yes,
back pain is the #1 reason why people go to the doctor. All right. And low back pain is going to be discussed today because of a correlation it also has. I did a quick Google search and 231 million results came back of the link between back pain and depression. So back pain is very important, and we're going to discuss it today. We're going to give reasons why we have back pain, of course, with any treatments that you can do at home, and then what we offer here to help you if those no longer work for you. But what are some of the common complaints we hear, Dr. Gabby, from patients who have this low back pain?
So typically a lot of the common complaints are going to be musculoskeletal related. And what that means is the muscle or the skeletal structure, the bone, is actually affected. The other aspect is going to be an injury of different types. It could be a traumatic injury, like an athletic injury, an impact type injury, a car accident, or it could just be a repetitious injury, right? We see this quite a bit in cashiers, twisting motion, machinists, forklift drivers, even just sitting at a computer for hours and hours and hours at a time, repetitive type complaints. Also disc herniations. I can't tell you how many friends when I run into people at the grocery store, things like that, they find out I'm a chiropractor and they're like, oh, I got a disc herniation. So disc issues is a very common one. And then also much less common, but it still does exist and it occurs occasionally, is something called a space occupying lesion. And what that is, it's a very fancy way of saying a type of tumor. Sometimes they are cancerous and sometimes they're more benign. But yes, tumors do exist in the spinal region, and so occasionally they do cause pain.
A lot of times that one of the later findings with cancer is somebody complaining about bone pain, whether it's bones of the spine or just bones in general. That can definitely be one of the reasons why they complain of the pain.
Yeah, absolutely. All right.
So how many people are going to have low back pain? It's about 80% of all Americans are going to eventually have it throughout their lifetime. But only 1/3 of those patients even seek help from their doctor. Okay, so that tells us just deal with this common condition if almost 80% of all people get back pain.
80% of all people get low back pain in the average population. I know I have a history of low back pain. We're going to talk about it here in a bit, but from a very interesting issue. But then also I know you have a history of low back pain, standing on your feet a lot, retired military, a lot
of activities that have been done can cause this back pain. And when you have back pain, there's a difference. It's either acute back pain, meaning it just happened and it's fairly recent, or chronic back pain, which means you've had it for an extended amount of time. So the short term is acute back pain. If you were just to do something, say you're out running or you're at the gym and you hurt your back, versus chronic means you've had it for a long time. The #1 predictor of the difference from somebody who initially hurts their back, who has acute back pain, of if it's going to turn into chronic back pain, is if they have what's considered maladaptive coping mechanisms, i.e. they stop doing activities. So if you hurt your back and you stop going to the gym, that's the #1 indicator that your back pain is now going to turn into chronic back pain. So if you hurt your back while you're skiing, if you stop skiing, that's the #1 indicator that this acute back pain will turn chronic back pain.
That's very interesting. That really is very interesting. All right. And so we did talk about the different aspects of the back as well. So, the back, we have a back side. So a lot of times people are like, my back hurts. Well, we're specifically talking about the low back. So we do have 4 regions of the spine. We have the neck, the mid back, the lumbar spine, which we're talking about today, and then the sacrum. All right. And so there are different parts of the spine. We're going to talk about back, the lumbar spine here, and then also a side view over there. So there's, there are a lot of components to it. And then, we've talked about this in the past as well. There is a difference between hip pain and low back pain. And sometimes we have to differentiate between the two. And I do love this picture because it lets you know where that correlation lies between the hip and the low back. And typically it's going to be musculature. So here you have the hip joint that's being shown, how it's attached to the low back, and then the low back itself. So, one of the #1 things we have to do as an office and as providers is we have to figure out, is this coming from the hip? Is this coming from the low back? Or even is this coming from somewhere else? So that's a lot of what we do here.
So with any joint, the back is multiple joints throughout there. Those joints need to be stabilized. All bones are held together through ligaments, but we need to move those bones, and that's with the muscles. Those muscles connect to the bone, then they also connect to the hip. If there's some discomfort from the back, it can be from the hip, as far as the hip has some sort of strength.
You are correct there. Yep. And so that's one of the things that we talked about. So again, this is the low back broken down. These are just the 5 lumbar vertebrae from the side. This is from the back. And then also this is the vertebral body here. And then this is the posterior aspect. Your spinal cord actually goes through this hole here that you see. That's where the spinal cord goes through before it goes either to the brain or separates into little individual nerves near the sacrum.
So when she talked about, go back a little bit here.
Oh, sorry, too far.
Backwards. There we
There
go.
we go.
When she talked about this here, this is that spine that you feel when you feel the back on your back. That is actually what you feel. That's the bone that you
Also
feel.
right
And then here, this is actually closer facing towards your stomach area. Okay. And then this is actually that protrusion you feel on your back. If you were to run your finger down your back, that's what you feel there.
I like to talk about dinosaurs, because you know how dinosaurs a lot of times have those spikes on their back.
There you go.
It's a similar aspect.
That's our version of it.
Yes.
But that bone is there to protect a very important nerve that runs through there, and that's your spinal nerve, and it runs through the hole that you see right here.
All right. And then also musculature, right? You mentioned muscles. So our muscles have 2 jobs. One is to stabilize the joint, and the other is to move the joint. And so with that shared, we have 24 movable vertebrae, 24 movable vertebrae in our spine. And they all do that with the use of muscles. And so we have different layers of musculature. You can see the deep layer here, very tiny muscles between each individual bony structure. Then we have intermediate muscles. Those are kind of sandwiched in between larger muscles and then the smaller muscles. And then we also have the superficial layer of muscles. Those are the bigger ones, typically the ones that you see people working out in the gym, or as well as the ones that you can see when you know, call it the cape muscle, but I know Arnold Schwarzenegger is always a good one to use, but you can always see a lot of the definition with a lot of those superficial muscles in his instance as well. So yes. And you know, we talked about this, you know, the different types of low back pain that exist in regards to injuries, in regards to degenerative issues. And so I myself just recently injured myself. So this would be considered an acute case of low back pain, doing a deadlift at the gym. And so, you know, a deadlift, there is form. Anytime you lift weight or give yourself a type of stress, you know, there's a specific form to engage proper musculature and make sure that we have proper form. And so I did actually injure myself. So injuries are quite common. And like you mentioned, you know, if the injury itself, even though it's an acute case of low back pain, if the injury itself prevents you from doing that activity ever again, it is more likely to actually cause chronic issues with that. And then the other aspect is degenerative disc disease. This is also a type of arthritic change in the spine. This is a healthy disc. It's like a shock absorber for our spine. It allows us to respond and recover and move easily. And it also keeps pressure off of the nerve root that comes out. So with that shared, there's different phases that occur. And when discs look like this, typically this is a chronic issue. It's something that has existed for years and we've just put off and pushed aside and put off. And this is typically where we end up seeing patients come into the office. Although we do always enjoy seeing these cases because there's always a lot more.
Because we know that they need help.
Yeah.
And this is a great picture to show the cascade of healthy, not as healthy, extremely painful, to where oftentimes at this stage here, it may not even be something treatable. We want to prevent it from getting that far. But this is a nice cascade of how the discs degenerate over time.
Yes.
But there's Daniel Blavey, he actually published in this Scientific Reporter that exercise is essential for having the intervertebral disc metabolism, which means the healthiness of that disc. The juice within there needs to be very healthy and filled so that you can move your joint spaces, because with your back, it's just multiple joints. It needs to be able to move. All right.
Yeah.
So this needs to be very thick and healthy. Exercise and activity actually increases that.
Yes.
All right.
The movement, just to caveat on that.
The movement of you flipping those slides.
Yes, the movement of me flipping those slides.
We do love the slides, but I think we have to work on our slide function a little bit better.
I got really excited there. I was trying to go back. We were talking about discs. I did want to share about movement, not of the slides, but movement of the disc space. What it actually does is it creates a pumping motion to help keep that disc space filled. So when we talk about that, this can be helped with movement. And so that's what that study's talking about with exercise. You know, here in the office, we have specialized equipment that helps us to regenerate those discs. But overall, just activity in general, just getting out there and moving, not necessarily pushing yourself through all of the pain, but pushing yourself to that point of discomfort is a very healthy and good thing to do, so that we don't see this type of transition, but more of a reverse transition there, or avoiding degeneration completely. So yes.
Perfect.
All right, and so what are some things that we can do at home easily, aside from the activity that we just talked about, right? So, you know, I did a deadlift at the gym. I hurt myself, Lonnie. Please tell me more about what I can do at home to help support myself through this process.
So low back pain is a musculoskeletal issue. With all musculoskeletal issues, the first thing we do, and we want to keep this one brief for the low back pain, but we want to rest. We want to rest. Not do those activities that are going to cause us pain. If doing an activity causes pain, it's not good for you. The second thing we can always do is add ice. You want to calm down the inflammation, whether it's in your low back or your shoulder. RICE is always the first option, and RICE is a good acronym, right? Rest, ice, compress, and elevate. And we have this beautiful slide here that kind of helps to remember that, because this pig, he is very restful. Of course, we have some ice, and then we're compressing the cars. So if you can put pressure in that area to help relieve some of that pain, that will help the injury heal much faster. And of course, this cool little 2-year-old, he's elevating to the next level. But really with that, you just want to elevate it above the level of your heart.
And you did mention, you know, we always want to get back to our activities. There is always a time frame. You know, there's a sweet spot getting back out there, and it, you know, it is actually a very short amount of time, you know, typically just a couple of days before you need to start moving again, encouraging yourself to get going, to go back to those normal activities, and just know your limitations. Yes, absolutely. And so, you know, with that shared, 70 to 90% of people will improve on their own. Yep.
That's kind of back in the beginning when we talked about, only a third of the people seek care.
Yep. And so, and that 79% of people, that happens within the first 7 weeks. So it does take some time, right? We just mentioned, you know, get back out there, just rest for a few days, and then get back out there and do what you need to do. That does take time. In regards to 100% recovery, it takes about 7 weeks in regards to research and doing it on your own without any external help, like coming to us.
And of course, that 7 to 10 days is, it's a spectrum. You know, when you were 18, you could do an injury and you'd be back the next day. But as we age, I know Dr. Gabby's not as old as I am, but I probably heal much faster.
You know who else I'm younger than?
Dr. Hewlett.
No, I was going to say Ronzo. I thought I'd give him a little shout out of this one.
Yeah. So as you age, you know, your healing process does slow down a little bit. So you may be a little bit later on that 7 to 10 day spectrum, but still knowing that 70 to 90% of all patients who do have back pain are going to improve on their own. They don't even need to come see anybody.
That's very true. Very true. And then also, you know, what can we do? Let's just say
you don't heal on your own.
We don't, you know, it's past 7 weeks. This is something that's existed for years. Can't anymore. I'm not able to go to work. This is affecting me financially in more ways than one. You know, what are some other options out there or common treatments that exist?
Typically, we always try and self-medicate. You know, typically a patient will go to their Walmart or their CVS, multiple different over-the-counter medications to try and alleviate this back pain.
And then what else? So you know, ibuprofen, Aleve, it worked for a little bit, but it's really not doing anything. It's not masking it. It's not taking care of it.
Then you go to your primary care, or you go to an urgent care, and you say, hey, I've got this back pain. It's not going away. I've tried Tylenol. I've tried Motrin, and it's not working. So So typically what we prescribe is opioids, but opioids are not necessarily the fix-all. They do take away the pain for a minimal amount of time. So that's why we only recommend about a 3 to 7 day period of those. But it's not good research. It's not good studies. The Journal of American Medical Association grades studies, and there was a study about opioid usage with back pain. So patients who had opioids, there's the research as far as how effective is this. And with any research study, there's a score. So it's kind of like when we went to the school. There's a 0 and then there's 100. Well, actually medical research, if you get anything over 20, it's actually considered relevant, meaning that we would give it recommendations to say, this is what we should do. Opioid usage with low back pain got a score of 13. Not relative. It means it doesn't give us enough evidence to say this is good practice.
Wow. Opioid usage. I just want to make sure everybody heard that.
13.
Opioid usage, research-wise, got a score of 13. 13. Yep. Not good. Okay. And this is standard right now.
Yep. Unfortunately, you know, a patient comes in and they're in excruciating pain. What else is there? And it's not necessarily that it doesn't take the pain away. It's just it doesn't help alleviate the situation. Having pain, but yet what else can I do?
Yeah, absolutely.
Yeah.
Well, and then also, you know, from here, I do know that typically the next standard is going to be injections of different types, but typically steroid injections.
And once the steroid injections stop alleviating the pain, then it gets to be more serious, as you see here, to where you end up having to lock down those vertebrae, the backbones themselves, stop them from moving. Because the movement itself is what's causing the pain as it comes close to that nerve or puts pressure on that nerve. And so, you know, we had surgically stop the bones from moving.
And add hardware in there to lift off those nerve roots. Gotcha. Absolutely. And so, you know, we're really excited to be sharing this. Our name behind us, our logo, Back Pain and Sciatica Center of Texas. So this is something that, you know, really talks to home whenever we, you know, for here in the office and then for Lonnie and I as a team. And so we have so many resources here in the office to help patients through this process, and in some instances, you know, really take care of them and get it taken care of in less than that 7-week time frame that would happen on your own, or in a lot of those chronic cases, you know, prevent you from having another episode that puts you on your back or off your feet for multiple weeks. And one of those things is
trigger point injections. Yeah. So we utilize trigger point injections because the muscles that hold the spine over time, you know, you have life, you've got kids, you've played sports, you've done activities. Those muscles themselves, they're actually like a fiber, and the muscle fibers should flow very smooth. But as life goes on, sometimes those muscle fibers will break. Well, if they don't heal properly, if they heal improperly, it gets to be a tangled mess. This tangled mess is doesn't hold very well, and it's very tender and it's very painful. So we need to break that up. And we utilize trigger. Explain it to a patient. And it's just 3 medications. 2 of them are for comfort measures. You know, when you go to the dentist and they numb your gums, that's what 2 of them are for. The last one is actually an all-natural botanical. It's made of 13 different botanicals called Trameal. And Trameal is a great option. It's an all-natural anti-inflammatory. So it's like a natural Motrin.
Wonderful. And it's directly into the muscle.
Right into the muscle.
Awesome. Yep. And, you know, some other things that we can do here in the office, you know, as a chiropractor, that we specialize in a lot of different things regarding the musculoskeletal system. And, you know, a lot of that is to make sure that we can get a lot of that function back. And rehab is something that we utilize. Rehab is a phenomenal resource to help strengthen the musculature that surrounds the spine. We have muscles in front, we have muscles in back, we've got muscles on each side. We have different functions for each of those muscles and movements that those muscles do. And so with that, we have rehab exercises specific for different spinal groups, as well as different functions in regards to what's going on. And I wanted to make sure that everybody could see our office. So these are our rehab tables. They are designed for 2 people at a time. And so we've got a beautiful facility for stretching, making sure we increase range of motion, and then also eliciting movement to those specific areas. You know,
we want to get them back to where they were.
Yep, exactly.
Initially, we talked about the back pain as far as the number one predictor of acute back pain turning into chronic back pain is you stop doing the activities. That is what a large rehab area set up within this clinic is designed for, to help you get back to doing those activities. Yes. We don't want you to not do those activities because we know acute back pain turns into chronic back pain if we do not do some good physical rehab. Yeah,
absolutely. And you know, this isn't just for activities. This is also for work. You know, we see a lot of patients that can't go to work right now because of their low back condition. We have a lot of patients that can't go play tennis because that's what they love, and they can't do it because they're in so much pain. And the recovery aspect. So this is a huge aspect of what we do and why we do it, because we want to make sure you have the strength to do what you need to do to hold through.
If you're a stalker and you're constantly lifting heavy cases, you know, chances are you're going to have low back pain. But we don't just stop doing that because we need to continue working. We need to continue our life. So a great option is physical rehab to get back the strength and the stability that you need to function.
Yes, exactly. And another aspect is decompression. We talked about degenerative disc disease, right? We talked about that disc space closing out. I actually have a model here to show everybody. So with that, you know, the nerve space, there's pressure on that nerve root. And so these chairs are specifically designed to help open up that joint space and get pressure off of that nerve root. And it does that through a very specific pattern, very specific stretch, and it actually has a vibration therapy component to help relax the tissue around it so we get the best results and the best relief. And so what this does is over time, it helps to get pressure off of that nerve root, but it actually will and does rehydrate that disc over time, right? We talked about movement. We've got to get movement in these joint spaces so that they can do their job properly and allow that proper
motion
movement.
Is lotion with all joint spaces. The more movement you have, the more lubrication, the better it feels.
Yes, and I do love these decompression chairs. They are state-of-the-art, and they work phenomenally to help with so many different things, from sciatica to, you know, even chronic disc disease, disc herniations, even muscle spasms. You know, it's great to just stretch out those muscles and work through the tissue. And then, you know, one of the other things that we do here is chiropractic. We adjust almost, if not all, the patients that come through here because mechanically, the spine needs assistance sometimes, right? Sometimes it just takes a sneeze, but other times we trip on our own feet. And so with that, we need to make sure that we adjust the spine. So similar to why we align our car tires and rotate those tires, we get the best mechanical function from our spine, also from our nervous system. So here's some tools that we use here in the office to adjust the spine to are working and getting you back where you need to be. And so, yeah, that's low back pain. You know, it affects 80% of the population. 1/3 go to the doctor for it.
And the other 2/3 suffer through. But if you've tried those at-home methods, as far as the Tylenol or the Motrin, or even if you went through the traditional care as far as trying to get prescription medications or the steroid injections, and you're still suffering with the pain, you know, you've exhausted all those resources, and really the last one is surgery. But that should always be the last option. There's great options that are all natural that we do here to be able to help patients that are going to have low back pain, not have chronic low back pain, and to get back to living a fulfilled, healthy life. I hope you guys learned a lot about low back pain. We love talking to patients and answering questions and talking about different conditions. So we will see you next Monday for another edition of Medical Monday.
Yes, we will. Bye-bye now.